Hello, thank you for this opportunity to join your event today. September is Muscular Dystrophy Awareness Month, and there is so much going on in the Limb-Girdle community. It is truly an exciting time. I appreciate this opportunity to join you today to share a little bit about my life journey and the advocacy work that I do. For those of you that do not know me, I am Carol Abraham, and I am joining you today from the United States. After graduating from the university, I worked for approximately 20 years as a registered occupational therapist. I am the founder of Limb-Girdle Muscular Dystrophy Awareness Day, which is celebrated worldwide on September 30th. I am the president and founder of the LGMD Awareness Foundation, which is an advocacy organization dedicated to globally raising awareness of the rare neuromuscular diseases known as limb-girdle muscular dystrophy. In collaboration with other LGMD foundations, our focus is to provide curated educational information and resources for the greater limb-girdle community as well as the general public. By increasing awareness of and advocating for individuals living with limb-girdle, we hope to assist in advancing the diagnosis, care, and treatment for individuals around the world. In addition, I serve as the vice chair for the International LGMD Conference. This amazing 4-day event was recently held and attracted approximately 1,800 participants who joined us virtually from around the world. In addition, I am the Director of Community Outreach for Coalition to Cure Campaign 3, which is an organization focused solely on finding a treatment and a cure for limb-girdle muscular dystrophy type 2A, also known as LGMD R1 Campaign 3 related. My journey began around the age of 5. My first symptoms included toe walking, difficulty keeping up with my peers, and frequent falls. Around the age of 9, I received my initial diagnosis of LGMD, which at that time was sort of a collect-all diagnosis indicating that I had muscle weakness in my shoulders, my upper arms, my pelvic area, and my thighs, which they thought would get progressively worse over time. No one in my family was diagnosed with limb-girdle. There really wasn't much known about the disease at that time. I lived in a small rural community. I knew no one with limb-girdle muscular dystrophy or even any form of muscular dystrophy. When I was 50, my neurologist encouraged me to have genetic testing to see if we could determine what form of limb-girdle that I had, since science had progressed significantly over the past 4 decades and they were beginning to understand a little bit more about limb-girdle and the different subtypes. The simple blood draw needed for the genetic test was a huge pivotal point in my life. After receiving my genetically confirmed diagnosis of LGMD 2A, my life changed. I finally was able to connect with others who were diagnosed with limb-girdle. The internet and social media opened up a whole new world for me as I discovered and I was able to connect with others who were facing the same daily challenges that I have encountered for years. I discovered I wasn't alone in this disease journey. I did discover that many individuals living with LGMD also felt isolated. I realized that many of my LGMD peers had limited understanding about the disease process or even had misinformation about the disease. Many felt alone and were frustrated, as even their local healthcare providers really had limited knowledge. In addition, their friends, their family, their co-workers did not understand the challenges that Limb-Girdle created in their life. And that is what prompted me to create Limb-Girdle Muscular Dystrophy Awareness Day. The first LGMD Awareness Day was celebrated on September 30th, 2015, and I am proud to say that it continues to grow each and every year. It is now celebrated around the world. So, what is advocacy? The term advocacy can be a little intimidating to some people, but in reality, all of us are advocates. To me, advocacy is about finding our voice and speaking up. That voice provides the ability to effectively communicate our needs and bringing about change. Yes, we are all advocates. Even the simple act of asking someone to open a door or to reach something off of a shelf is a form of advocacy. On a much larger scale, advocacy is about bringing about change in our community. This could include changing policies, laws, or rules that impact how someone lives their life. These efforts can be targeted at local, state, or a national level. The focus could be changing laws or simply written or unwritten policy. Obviously, what is targeted depends on the type of the problem and who has authority over that issue. When assessing the greater Limb-Girdle community, issues of importance often include the need for genetic testing and identification of subtype, accessing support services to individuals and families coping with complex medical needs, the promotion of innovative medical research and product development, as well as establishing insurance practices that provide patient access to medically necessary therapies. I truly believe that individuals with Limb-Girdle need to be empowered to speak up and advocate for their rights and needs. We need to tell our stories and share our experiences so that our voices can be heard within our community, by our government officials, in the news media, as well as across the internet. By uniting and speaking up, the voice of our diverse and growing community can become stronger, while working together to break down the barriers that still exist in our countries, and therefore we can facilitate the change necessary for accessibility, healthcare, and equality that we deserve to enable our full and active participation in society. It is time to unite as we advocate, educate, and celebrate. Remember, by telling your story and sharing your experiences, you help others understand what it is like to live with this disease. You play an important role as an advocate and in raising awareness. With the emerging treatments on the horizon, this is truly an exciting time for the entire Limb-Girdle community. It is a time for all of us to unite and take an active role in shaping our future. It is important to seek a genetically confirmed diagnosis, to get your name on a Limb-Girdle patient registry, and consider participating in natural history studies and clinical trials when they are available. The Limb-Girdle community can help drive research forward to find a treatment and a cure for all of us. Although we celebrate LGMD Awareness Day on September 30th, advocacy is an ongoing process that must continue throughout the year. Hopefully, by increasing awareness of limb-girdle muscular dystrophy, individuals living with the relentless disease will have an easier time accessing genetic diagnosis, care, and treatment. So as the world celebrates the 7th annual LGMD Awareness Day on September 30th, we invite you to join us as we advocate, educate, and celebrate. There is great strength in awareness, understanding, and unity. The Limb-Girdle community demonstrates global connectivity each year when we campaign together and gain recognition for limb-girdle muscular dystrophy. With over 30 different genetic types of LGMD, the act of collaborating globally makes us stronger than we ever could be alone. Whether you are a longtime community member or new to the scene, your participation in the 2021 LGMD Awareness Day activities is important. Awareness can spread much faster with more individuals from all parts of the world participating. There truly is power in action. In collaboration with our advocacy partners and LGMD foundations around the world, we invite you to take a moment and shine a light on the importance of LGMD awareness. Advocate, educate, celebrate is our theme this year. To help advocate, we invite you to participate in our Gertie sticker campaign. Social media provides a great platform for advocating. To help educate the world about Limb-Girdle, we invite you to share your story. No one knows this disease better than the individuals and the family members living with Limb-Girdle. On social media and on our website, lgmd-info.org, we also have several LGMD facts that you can share with your friends and peers. And when it comes to celebrating, by all means consider wearing lime green for Limb-Girdle awareness. Wearing lime green awareness ribbons or even an awareness wristband are great ways to raise awareness and spark up a conversation. So take a moment to shine a light on the importance of Limb-Girdle Muscular Dystrophy awareness and join us as we advocate, educate, and celebrate. Remember, together we are stronger, and together we can make a difference. Thank you for allowing me to join you today. I appreciate the opportunity.